So right now, I think we are all beginning to try to figure out what is the definition of value. And of course, it depends on who's looking at it. The perspective I think we've had at ASCO, and I think really even NCCN is looking at saying, the value needs to be given to the patient for them to make a better informed decision. So I think both of us have worked pretty much in similar ways, even though they're a little different, in trying to come up with some way of translating the benefits and risks of a treatment and then its cost to a patient at any point in time, so they can begin to weigh out all these factors in trying to make a better informed decision. So I think NCCN and ASCO have a little different methodology to come up with, I think, a similar type of product to offer patients and their physicians to have that discussion. And I can give you the details of the ASCO program. So where we are on that right now is really the first attempt to try to begin to define value for a patient to use. And it needs to really be adjusted and developed over time. So ASCO had a large committee of our members, volunteers, and others put together the first shot at a value framework that was published last year in the journal Clinical Oncology. And basically the framework works where one looks at the evidence of the benefit of a treatment, and the benefit will be defined as a higher cure rate, a longer time of control of disease, a longer survivalship, and along with that it measures against it the toxicity, and the toxicity meaning how the drug has negative effects on the patient. And what they've come up with is a numerical system to begin to develop what's called a net health benefit. The plus is the benefit you get from the treatment, the minus is the toxicities you pay. And then once that net health benefit between two different treatments is calculated, then you begin to look, all right, well, what is the cost differential between the two treatments? Now, this is really just started and it's not ready for prime time use, and it has to have a lot of adjustments. It needs to be developed even more, but it started the conversation, and we actually have a tool that will need to be improved upon before it's really ready for prime time use. But the conversation's going on right now, and there's input being put into it, and it's actually being adjusted as we speak, and sometime this year will be republished in a new form. But it's certainly on its way.